Good afternoon and good morning, everyone, depending on where you're at. It's a sunny afternoon here in Florida. You know, it's interesting. I moved here to Florida about a year ago, and all the allure and mystique of Florida kind of goes away in the summer. You know, it's a little bit hot down here, and we're expecting a thunderstorm, as happens every afternoon here in the sunny state of Florida. Anyway, let's get started and talk about preschool screening. So we have an hour here today. We're going to talk about the PLS-5 screening test, both for the English and Spanish versions. We will just kind of go over some commonalities between the two of them. But we have an hour. You know, feel free to put any questions you have in the chat box on the lower left-hand side of the screen. Nancy Castilleja, who is the product manager for Pearson, and working with the PLS-5, is manning that chat box, and we'll be able to answer anything that I can't get to. So thank you, Nancy, and hope you enjoy the next hour. Very quickly, pretty clearly I am an employee of Pearson, but I do want to mention that to all of you that this is a webinar discussing the PLS-5, which Pearson publishes. Here's our agenda. We're going to talk about, we're first going to hit on the importance of early screening. I think sometimes this is an overlooked point, and I'm going to make some points here, some discussion points here, to really drive home why early screening, and particularly looking at the PLS-5 data, is going to be super important. And we're going to really look at, in detail, at languages linked to learning. We're going to talk about an overview of the PLS-5 screening test for early childhood educators, why there are separate English and Spanish versions and editions. We're also going to look at a sample of some of the test items and scoring, and then we're going to have time for Q&A. I just want to let you know that there's a little note at the bottom. You all did receive an email today. It would have come through earlier in the day with a link that said downloadable files for the handout. And the handout will look different than what you're going to see on screen today. And the reason for that is it's proprietary information in some of the slides, and I wanted to make sure that with your handout it didn't contain any of that. So if you see any differences, that's exactly why. All right, let's hit on early language development first, and why, again, we're going to hit on this and talk about this for a little while, and why it's so important that you screen for language difficulties early, and why it has implications for later learning. We know that many children will enter school, and I'm talking kindergarten, first grade, with a pretty significant weakness in early language. Going back to the 70s, Hart and Risley are two researchers that did a lot of work on understanding the differences in language development between socioeconomic backgrounds and where children come from. And in 2002, they did a little bit of an update that just talked about the differences in the amount of words that children heard every year. And it's pretty staggering. And when you look at how children in poverty, an average hearing 250,000 words per year, and you compare that to children in the homes of professionals that heard up to 4 million or over 4 million words per year, that is sort of a staggering difference. And this language link is super important for us to analyze and for us to keep in mind, because we know that exposure to vocabulary is directly linked to the acquisition of vocabulary overall. So if children are exposed to less words per year, their vocabulary acquisition is going to be significantly lower. And that makes us really step back and think about the differences between children that come into our preschool, or children that come into our kindergarten classes. So it is important for us to keep this information in mind, again, really emphasizing the need for us to screen for these weaknesses early on. Not necessarily to indicate whether or not there's a disability. I'm talking about screening, right? I'm talking about the ability for us to say, hey, this child's language acquisition is below his peers, his or her peers, so we need to take notice. Maybe we change up some of our educational practices, so maybe we refer them for further evaluation, for more in-depth evaluation. Either way, whatever your decision is, we need to keep in mind how important that acquisition of language is. And again, just to make that point additionally, Berninger, who is an author of several educational academic achievement tests, really talks about the link between language and literacy. And and how the early development of reading does depend very critically on whether or not a child is developing receptive phonological components. So it's important that we keep in mind the development of literacy later on really being impacted by their early language development. In terms of developing language competence, think a little bit more in depth about what the connection is between oral and written language. Asha in 2001 came out with 4 points. So I have A, B, C, and D, right? Next slide. 4 points really talking about why that link is so important, talking about how oral language provides the foundation for development of reading and writing. That word is very powerful when you think about the foundation. Basic skills really being necessary for the development of more complex skills. Oral language being necessary for the development of written language. So think about that continuum, being on the same pathway where oral language occurs first and written language occurs after that, or develops after oral language is already started to develop. So we know that foundational link is super important. The relationship between oral language and literacy development is reciprocal, though, because there are interconnections in early childhood. So if you think about that reciprocal idea, the reciprocal nature of it, what does that mean? Well, as a child's oral language develops, the more they develop reading and writing. And as reading and writing develops, the more exposure they have to additional vocabulary. Just on a basic level, if we think about it that way, that if a child comes to school with oral language that's developing faster than appears, and they start to develop reading earlier, then they start to become exposed to more and more vocabulary, and they sort of develop and piggyback off of one another. So that reciprocal nature is super important for us to consider. We also do know that children with speech and language impairment are at an increased risk for difficulties with literacy development. So we know that that's the case. It's backed by many years of research. So we have to keep in mind identifying those kids with the weaknesses as early as possible. And we do know that intervening for oral language can positively influence literacy development and vice versa. So again, talking about that reciprocal nature, addressing one area can positively or negatively impact the other, or not addressing one area. So we know that reciprocal nature does exist. Let's look at the importance of early screening. This might seem, for most of us, to be very apparent, but it is important for us to think about why this screening is necessary. Screening has been coming out in state legislation by the truckloads almost recently, where many states are now saying we must screen for this, we must screen for that, reading, language, all these different areas. So these are all areas that we must keep in mind. Folks, let me stop for a second. I'm getting some notes that my audio is having difficulties. I apologize for that. Hopefully I can keep this in a decent area. Hopefully this won't be too much for you all. But let me know if my audio is really problematic. Oftentimes it's internet speed on the viewer's end, but it could also be my audio line coming in, so I apologize for that. So what we know is that many children don't successfully acquire speech and language skills prior to school. So we know that's the case. So that's why we need to screen for this general area as soon as possible. We should really think about them as being the first step in an assessment process. Not everybody is going to need a more in-depth assessment. Not everybody is going to need to go through a diagnostic process. But looking at that difference, looking at the difference with how different children are entering school will help us start the intervention process. It really allows the educator to close that language gap. And if we go back a couple of slides and we think about that reciprocal nature between oral language and written language, and we start to think about how when kids are exposed to more and more vocabulary, they then develop more and more vocabulary. That really makes a lot of sense for why we need to screen earlier and earlier. So Pearson developed the PLS-5 a while back. It's on the 5th edition. And also the screening test has been around for quite some time too. But this screening test for early childhood educators is a new development. And let's go over what it is and why this is such a great assessment for us to have or for early childhood educators to have in their toolkit. So it is a quick screener for language skills in either English or Spanish. And what it does is it allows you to identify children who may need to be referred for further assessment or more detailed levels of assessment. That is sort of the second component of it. The first component of it, which I don't have a bullet for up here, is it can also help you identify those kids who just need additional intervention, may not need additional levels of or more detailed levels of assessment, but may just need additional intervention. So there are really those two main points of the outcomes. It allows us to screen children in a wide variety of settings, and with a pretty wide age gap there, we can look at also older children, 3-0 to 6-11. And it is important for us to remember that this is not a diagnostic assessment. So let's differentiate between the two very quickly. A diagnostic assessment is going to be much more detailed. We're going to be looking at skill in multiple ways. So we may look at one skill, let's say expressive communication, using a number of different avenues rather than a smaller amount of items to be able to say these are possibly indicative of speech and language weaknesses. So it's important for us to differentiate between the two. Screeners should not be used in the diagnostic process unless they're the first step in assessment. So many times what happens is somebody will give a screener and use those results to inform the diagnostic assessment process, and that's absolutely fine. But we should not be giving a screener and then making a diagnosis from that. It's not meant for that. They're not developed that way, and we would make erroneous decisions for children. So some additional information about the PLS-5 screener for early childhood educators. It is qualification level B. Feel free to go to the website that I've listed up here on the screen for additional information about what that qualification level means. But essentially, it is indicative of somebody having a master's level degree with specific training in standardized assessment and the area in which you're testing. So that tends to be how we classify this. Now, in many situations, having someone supervised who has those qualifications, it can be administered by people who do not have that level of qualification, but then is interpreted and the scores are and the decisions are in the hands of the person who meets that qualification. It can also work that way as well. The thing about completion time, it's only 5 to 10 minutes. It's not timed, so the completion time is very, very quick. In terms of scoring options, it is manual scoring, and I know sometimes the manual scoring can get people to be a little nervous, but I will tell you that the scoring for this test is very easy, I promise, and I'll show you a little bit about that later on. We can test kids from birth all the way through 6 years, 11 months, so that's a pretty wide age range. We have 1, 2, 3, 4, 5, and 6-year-olds age bands. So we have each age band reflecting unique aspects of language development. So that is very helpful for us to really analyze the differences between how language is acquired. Oh, I apologize. I missed the first one there. It's the second bullet. I don't know why I did that. The first age band is birth through 11 months. Then we have each age band at each of the years. I'm getting some information that I have lost audio. Hold on a second, folks. Okay, let me talk this way. Hopefully it comes through a little bit clearer. I apologize. There are two versions. The English version is going to be used for children who speak English as their primary language. The Spanish version is for children speaking Spanish only, or for children speaking Spanish and English with Spanish as their primary language. Okay, so I'm wondering if you can give me some ideas. Go ahead and throw some ideas in the chat box. Why do you believe that we have two versions? What are your thoughts about why there are two versions? Why do we have both an English and a Spanish version? Addresses validity concerns, Detra says. Different norms, or makes it more reliable, for understanding students. So if you think about this, when we're screening for two different types, the reason why we have two different types of assessments here is we want to screen for their primary language. So if we have English speakers who, well, let me think about it conversely here. If we go down to the Spanish one, if we have children who speak English and Spanish, and their primary language is English, we want to be able to screen for their abilities in English first. They may speak about the differences. We may look at the differences in phonology between Spanish and English. We may think about the differences in acquisition of different sounds. So we want to be able to analyze them differently. So I want you to really analyze which one you need. And if you do have Spanish speakers in your setting, the Spanish version is necessary for those who speak Spanish only. I know we get a lot of kids who come through who speak 2 languages, but Spanish will be their primary language. And their primary language is usually indicated by those who speak, by what they speak in their home more fluently. And in younger children, this will be a lot easier for you to differentiate. All right, let's look at what you're assessing. So the domains here are assessed by age group. So if I look through 0 through 611, we are assessing language, okay? Feeding is assessed from 00 through 111. Articulation is from 2.5 through 611. From connected speech is going to be 30 through 611. Social and interpersonal language is 0 through 611. And then stuttering and voice are both 30 through 611. In terms of scoring and interpretation, for infants and toddlers, there is a pass-fail criterion, and we're looking at emerging interaction and language and speech skills. For children ages 30 through 611, again, pass and fail scores for articulation, language, social interpersonal communication skills, stuttering, and voice. Thinking about the administration, the basics of the administration for this, again, it's a screener. It's very easy to give, but there are some basics that we have to keep in mind. So for very young children, that would be 0 through 1 year, 11 months, information for this test can be gathered from a caregiver about the child's target behaviors. So you can use the caregiver questions to inform your assessment here. It doesn't always have to be elicited. Now, if you can assess that through looking at the child, then that's possible. But the caregiver can also give information for you to rate those areas. But when we're involving caregivers, the question always comes up is how do you do it and should you do it? It's important, especially in the evaluation of young children, for you to involve caregivers anytime possible. It's a critical aspect of test administration, particularly when we're looking at young kids, because a lot of times we can't get kids, or kids won't perform when we're asking them to, or our understanding of what a child can and can't do is not deep enough unless we can understand from a parent's point of view. So it is important for that. You will give credit for passing specific test items if the caregiver can provide examples of the child's behavior at home. So they may say, yes, he can do that. You just want to make sure that the parent understands what you're asking of them, and the way that you do that is through getting examples from them. Information needed to score an item may be obtained by using the caregiver questions listed in the administration directions. So administration directions will have questions that you can ask parents to flesh out this information, to flesh out the data, to score yes or no. So it is very helpful. The test does provide that information to guide you. What you want to do, though, is make sure that you prep the caregiver prior to participation. You want to make sure that whenever you're talking to parents and whenever they're involved, that they know what they can and can't do and what they should be answering and should not be answering. It's an important conversation for us to have before we actually start our testing session. In terms of the administration, it is individual, so we cannot give this in groups, so that's important for you to consider. You will need the manual and the record form, and what you'll need to have are the manipulatives only for the specific item that you're administering in front of the child. Again, remember we're assessing young kids here, so it's important for us to keep any distractions out of in front of them, keep it as minimal or as distraction-free as possible. And it is important that you administer only the age-appropriate items. Again, we're looking at screening, so it's pass or fail. So there is limited benefit to administering certain items that are not age-appropriate. I know a lot of folks will say, hey, sometimes I administer items out of the age band to get a sense of what they can and can't do. With a screening test, yes, well, let me go back. Yes, that's possible with many diagnostic assessments where you give something out of standardized practice and just analyze them qualitatively rather than actually looking at the data compared to the norm group. But for a screening test, that benefit is minimized. So I want you to limit that practice with a test like the PLS-5 Screener and reserve that practice if you are a trained professional clinician to look at that a little bit more in detail with other assessments. Okay, in terms of manipulatives, so ages 0 through 2 years, 11 months require the use of toys or objects that can be found pretty easily within the child's environment. So here's a list of what you'll need: a squeaky toy, infant toys, spoons, 3 keys, a bottle with a nipple or pacifier, a cup, bowl, bubbles, a watch with a second hand or a stopwatch, 1 or 2 of the child's personal age-appropriate toys, a sealable bag, and age-appropriate crackers or snacks. All right, let's talk about the test sections. All right, let's think about the language section here. So for the first one, points to things that you wear. Essentially what you'll be asking is you would be asking the child to point to certain things on their person that they may wear or that their mother or caregiver may be wearing. So it's show me your shoes, show me your shirt, point to mommy's socks, point to daddy's hat, where is mommy's, etc. So these are the words that you'd be asking. The interesting thing about when you're looking at the sections is that it will give you good information about what you need to do, what you need, your procedure, and then also the prompts. Always remember, and this is the case for most tests, but I will tell you that for this one particularly, anything that's written in black ink will be instructions to you. Anything that's written in blue or bluish color ink will be what you actually read. So you see here that the procedure or the materials are none. You don't need any materials for this. You will ask the child to point to his or her clothing or ask them to point to the clothing items listed in A through D that are worn by someone else in the room. You should use the wording that the child is most comfortable with. And you can kind of see behind here, I know I have it blocked by this just because these are actual items. But I have specific, you will ask specific things like shirt, shoes, etc. The pass criterion for the language section is different for each age. So for ages 0 through 4 years, 11 months, a score of 4 or more items correct would be considered a pass. For ages 5, 0 through 6, 11, a score of 5 or more items would be considered a pass. Once the pass criterion for the language section has been met, the remaining language items do not need to be administered. So that's important. And once you meet the criteria for screening, you don't need to keep going in that section. Screening for the language of children ages 0 through 1 year, 11 months. In that situation, remember I said you may score based on a caregiver's report, observation, or elicitation. Always think about it that way. Think about observation and report being the first way to think about that information. If you need to elicit, you can. The caregiver questions are going to be provided in the stimulus pages. So you'll score 1 if the caregiver provides an example that meets the pass criteria. Again, the key word here is example. And you'll score 0 if the child does not demonstrate the targeted behavior. See how this is written here or how this is described? It's important for you to think about that. If the caregiver can tell you that they do something with an example, you give a 1. In this situation, we're assuming that the caregiver can't give an example. And then we moved on to elicit the behavior, and they did not demonstrate it. So think about that in terms of the development of your testing session. A lot of this information you will gather through report or through observation and then actually give an item if you need to. So that does cut down on your testing time overall. Make sure that you think about how that process works, and it will shorten your overall assessment in general. Ages 2, 0 through 6, 11, most items include sub-items that require responses from the child. So let's look at a couple examples. So here's an example. Number 1 is recognizes action in pictures. So what they'll see are specific pictures, and they'll have to identify what the child is actually doing or what the action is actually occurring, what action is actually occurring. So remember what I said. Always make sure you look at, see what the score is. So in this situation, a score of 1 would be 4 correct. So in our example for item number 1, recognizes pictures, action in pictures, the child got A, B, C, E, and F correct. That meets the criteria for 1, so I put a score of 1 here at the top box. If I go down to 2, the score of 1 would be 2 correct. In this example, the child got all 3 of them correct, so I put a score of 1 here. Item 3, a score of 1 is 5 correct. So this child got 1, 2, 3, 4, 5, 6 correct, so that earned him a score of 1. And number 4 uses plurals. It is 2 correct out of 3. So this child got all 3 correct, and we put a score of 1 in the box next to 4. Number 5, let me erase these arrows, give us a little bit better view. Number 5 is can say a 4 or 5 word sentence. Well, that's interesting. I wonder why that comes. I apologize for that, folks. Maybe because I'm using a screenshot from a sample manual, but that should say 5, and it just came up as incorrect in this screenshot. So I apologize for that, but it should say the child can say a 4 or 5 word sentence. So you would score 1 if the child says a 4 or 5 word sentence at least once. And in this example, the child did not, so we gave a score of 0 there. And all we do then is sum together all 5 of them, and it sums items 1 through 5, a pass score of 4. Items correct would be a pass for this. So in this situation, it's all listed here on the screen. Again, real easy for us to score. This child got a score of 4, therefore passes the language section. Okay, the feeding section. The difference here is we are looking for atypical behaviors. So we're looking for atypical behaviors in feeding and swallowing for children ages 0 through 1 year, 11 months. And in this situation, we are looking for atypical behaviors that can help us to develop or to explain further evaluation. We are going to be looking at atypical behavior patterns that are observed during testing or that are reported by the caregivers. So a pass criterion here would be that none of the behaviors are noted. So think about it as the absence of atypical behaviors rather than the presence of typical behaviors. So that's important for you to remember with this one. So under feeding, you see that you would check all that apply. Does the child demonstrate any of the following behaviors? Difficulty latching onto a nipple or bottle, has difficulty sucking from a bottle or breast, frequently coughs, gags, or chokes during feedings, etc. So for our example here, we have this one checked right here in the middle. Leaks large amounts of food or fluids from his or her mouth. So that one atypical behavior was noted, and they did not pass this feeding section. So it's important for you to remember it's the presence of atypical rather than the presence of typical. Okay? So in our example here, we have a child who did not pass feeding. The articulation section is going to be reserved for children 2-6 through 6-11. We are looking at speech sounds in the initial, medial, and final positions. So for children 2-6 through 2-11, we're looking at 5 target sounds. For 3-0 through 3-11, we're looking at 8 target sounds. And for 4-0 through 4-11, 5-0 through 5-11, and 6-0 through 6-11, we're looking at 10 target sounds. Some words that you will see will include 2 target sounds. So there won't be separate words for each sound. Some of them will include multiple. Here's an example. So what you'll do is you'll check the appropriate box to indicate whether the child says the sound that's in bold, the colored type, correctly or incorrectly. So the first one is pan or pot. We would mark whether or not they said the p sound correct or incorrect. Dog, you see the dog has 2 sounds there. It's the d and the g. So in this example, we see that the child did not say the d sound correctly, but did say the g. So an example would be bog when they saw this. A monkey is also the same. It has an M and a K in it. In this example, the child said the m sound correctly, but the k sound incorrectly. Teeth, we see in this example, did not say the t correctly. Horse was correct, and feather was incorrect. So again, the pass criteria is pretty explicitly stated here. Very easy for us to process and score. 5 or more sounds correct would be a pass score. So let's count them up. 1, well, let me erase this. We have 1, 2, 3, 4. So this child did not meet the pass criterion for articulation, and that's what I have listed here in the box. Okay, so connected speech. So connected speech is for children ages 3-0 through 6-11. What you'll do is you'll check the statement that best describes the child's conversational speech.
A pass criterion for this section is, for all ages, is you understand most of what the child says. So let's look at the difference here. What you're going to do is you're going to check one statement that best describes the child's speech. Let's read them all. So the first one is, you understand most of what the child says. And the second one is, you understand some of what the child says. Or the third one, you understand little of what the child says. Again, pass criterion for this is if you would mark the first box here. And in our example, I have that met. So this child passes the connected speech section. Social or interpersonal section. So again, this is going to be 0 through 2 years, 11 months. The statements describe atypical behaviors again. So remember, we're looking for atypical behaviors. If they occur, that means that they do not pass this section. Again, we're looking for the presence of atypical, not the presence of typical. We're looking for the presence for atypical, not the presence of typical. So what we're going to do is check the statements observed during testing or reported by the caregiver. Again, a pass criterion would be none of the behaviors are noted. So we're looking for the absence of those behaviors. Does the child demonstrate any of the following behaviors? Does not respond to his or her name when called. Does not shift attention from one activity or object to another. Has frequent tantrums that disrupt family life. Does not calm down when caregivers try to comfort him or her. Plays in an unusual manner. Such as interested in specific parts of an object, plays with the same object in a repetitive manner, etc. Does not use gestures or speech to initiate social interactions. So again, pass would be none of the behaviors are noted. And in this situation, no atypical behaviors were noted, so this child passed. I always think that this is a funny one when I think about the frequent tantrums that disrupt family life and the differences between children. You know, I have a son who just started kindergarten and a daughter who just started 3rd grade, and I always say that her tantrums didn't tend to disrupt family life as much as his did, but that's a little inside family joke. But I think we have to be very careful about how some of these are interpreted. We have to make sure that the tantruming is age appropriate and is not, and parents aren't latching on to a question like that and saying, oh yes, they're always tantruming. They're so disruptive in life. When a lot of what they're doing may be typical behavior. Okay, so for kids that are 3-0 through 6-11, so let's flip it around. So remember how we talked about the other sections being the absence of atypical behavior. So we're looking for atypical behaviors. If they occur, the child does not pass the section. That would be the case for 0-0 through 2-11. For children who are 3-0 through 6-11, we are actually looking for the presence of typical social behaviors. So at this point, we are not looking for atypical. We're looking for them to engage in typical social behaviors for their age. So what we'll do here is check the statements that best describe the child's social or interpersonal skills. A pass criterion for this age group is 4 or more statements checked. So for our example here, we would check all that applies. Greets you when you say hi, responds to your questions, speaks to adults, speaks to other children, asks questions, says bye when you say bye. So 4 or more would be a pass for this example, and this example did pass. This child example did pass. So just remember the difference between the two. We're looking for the absence of atypical for 0 through 2-11, and the presence of typical for 3-0 through 6-11. Okay, the stuttering and voice sections. This is going to be administered for all children ages 3-0 through 6-11. Typical and atypical characteristic of speech, children's speech, so we're looking for both. We're going to check the statements that describe the child's speech and voice. And the pass criterion here is no typical characteristics noted. Now quickly, before I go on, I did get an interesting question about why not eye contact in this section. Well, I'm going to actually throw that back to you all. Why do you believe that eye contact wouldn't be included here as an indication of screening for typical behavior, typical social behavior? Why do you think that if we included eye contact in here, why do you believe that that may or may not be a good way for us to measure the acquisition of social behavior, social language? So I'll give you a couple minutes. Feel free to type any ideas in the box on the left. And so I have a couple coming through here, and the two that come up, the two that came up that are pretty much hitting it on the nail on the head is the cultural differences. So if we think about cultural differences, and especially if we think about the differences in how children are, or the expectations of children today than they were a few years ago, even in a couple, 1, 2, 3 decades ago, eye contact is becoming less and less. Not less and less taught, but it's becoming less and less expected. And when we're putting together a test like this, where we're screening for behaviors, we want to make sure that we have behaviors that are going to be very well differentiate between kids with possible deficits and kids without deficits. So a typical development profile versus an atypical development profile. And eye contact was not one of those areas that was differentiating in this development. So the quick answer is cultural differences, and secondly, it's because of what we're expecting and expectations in language development, but also because it was not a good differentiator in this research. Okay, so we talked about stuttering and voice. In terms of the speech fluency section, you will check all that apply. So again, remember I talked about typical and atypical characteristics. The typical behaviors we're looking for are speaks as smoothly as peers, occasionally repeats part of a word, so repeating the nana in name, or occasionally repeats whole words, so my name. Okay, those are some of the typical characteristics we look for. The atypical characteristics would be they frequently repeat part of a word, they frequently repeat whole words, they have difficulty getting words out, or they appear to get stuck on some words. They have eye twitching when they talk, or they pause excessively when they talk. So in this situation, even though we're looking for both typical and atypical characteristics, the pass criterion is dependent on the absence of atypical behaviors. So if these are contrary. Some of these are contrary. So if I'm looking at something like occasionally repeating part of a word, that is opposite from, well, not necessarily opposite, but it is different or contrary to frequently repeating part of a word. So really, we have questions here that contradict one another. So if we're looking for typical, yes, they may repeat part of a word, they may repeat whole words, but if they frequently do it, that's indicative of difficulty. Also, if we look at the last three here, that would indicate to me that they're not speaking as smoothly as their peers are. So really, when you think about it, if we can say that they speak smoothly and they only occasionally repeat either words or part of words, then we can pass them in this situation. So no atypical behaviors will pass the child for this section, and in our example, that's the case. Okay, in terms of voice, again, we're looking at typical and atypical. And again, it makes sense if we look at the difference between them, that for typical characteristics, the voice sounds like other children of the same age and sex. And for atypical characteristics, the voice sounds hoarse, rough, or breathy. They cough or clear their throat often. They yell or scream often. Their voice sounds different from other children of the same age and sex. Their voice sounds like the child is talking through his or her nose, or as though the child has a stuffy nose. So again, pass criteria here is that they have no atypical characteristics noted. And in this situation, the child has voice sounds that are hoarse, rough, or breathy. So in this situation, they would not pass the voice section. And if we look at the screening summary, you should determine if any assessed areas or domains require additional information to be obtained. So you'll only check one box for each section for which the child was screened. In this situation, the reason why I say that is sometimes we need to gather additional information to screen effectively. And that's why I said bringing in parents, getting parent data and information, making observations, or actually having to try to elicit the behavior is possible or necessary in some cases. So you want to be able to analyze that, and don't screen a section, or don't give a rating for screening for domain unless you have the data necessary to make that rating. And you can see here that we will mark the boxes based on pass or refer for additional testing. So in this situation, and again, this is going to be based on the example we just talked about, the child passes the language, connected speech, social, interpersonal, and stuttering sections, and we would refer for additional testing for articulation and voice. And in that situation, going back, this screening summary can be very helpful for referring for additional testing. But if you're working together in an early childhood setting that has a speech and language professional or someone who is looking at these results, you may also at the same time want to think about changing increasing your educational interventions. So that's an additional implication of screening results. Just want to keep that in mind. So let's talk about implications for performance. If you have checked any box in the refer for additional testing column, you're going to want to refer for additional testing. So that's part number one. That's what it means. It's pretty straightforward, explicit. We want to be able to say to a speech-language pathologist, this is the data that we're collecting on child A, and child A is coming through as having potential areas of concern in A, B, C, and D. So you give them the information that you've collected from observations, from the participation that they have in the testing session, the participation that they engage in the classroom or in the setting that you're observing them, but then also the screening results. So making sure that you pass on those screening results, super important. You're going to be sure that if a child does not follow directions, attend to the task, or respond to test items, that you not just mark them as needing additional assessment. Sometimes behavior affects testing. That's just the nature of the beast, right? So we want to make sure that a non-passed item is not only due to behavioral issues or behavioral concerns, that they may appear to need additional assessment even though the child's skills may be typical. So keep that in mind. Many times, if that occurs, you can flesh out those weaknesses or those concerns through additional observation, asking parents more questions, and even giving the screening again to the child in a later time once you establish rapport. Interestingly enough, I had a conversation recently with a bunch of folks on an early childhood test, and what I said to them was, it's super important that if you don't know a child, you spend the first 5 to 10 minutes establishing a rapport so that you can limit the behavioral problems or the refusal of items as much as possible. If you know the child, that's probably going to be a lot quicker. But sometimes you go into a room or you have kids coming to see you cold, where you're not familiar with them, and you want to make sure that, especially for young kids, that we're giving them the opportunity to demonstrate what they know and not show us what they don't know. So screening really does take that persona on, which is, we want to see what they can do, right? We want to see what they can do. We want to make sure that we are giving them credit for what they can do. So that's super important. So in that situation, make sure that you're taking that into account and not just referring for additional testing just because the child's behavior is not cooperative. So I'm going to throw out questions now. What I'll do, I see Nancy's been very busy. Thank you very much, Nancy. I don't know if anyone has any questions that I did not answer. Go ahead and feel free to put some in the chat box if you want me to answer additional questions. I'll leave the box open for a little bit longer, and I'll read through it. This is pricing that is for U.S. customers, and this is going to be in effect through December 31st. Wait, I have 2016 up there. I apologize, Nancy. Can you clarify? This slide might be wrong. I apologize for that, folks. Let me go back and I have Nancy on the line. She'll be able to indicate whether or not this is correct or incorrect. This might be an incorrect slide, folks. I apologize for this one.
Which one is that, Adam?
The pricing slide?
Pricing? Well, that pricing was through December 2016, so I'm sure it's different now. We can. Okay, I apologize for that, folks. I apologize for that. Don't look at that section. I just noticed that as I pulled it up. So I apologize for that. I'm marking through it. So go here to the U.S. or the Canadian site, and you'll find the current pricing guides for that. That might have been pre-publication. So I apologize for that, folks. Any questions that have come up that I did not answer? Let's see here. I'm going to the, really I want to be it.
I see a question coming through about the differences between psychologists and how they interpret information. Interesting. I'm a psychologist as well. That yes, we do tend to be very measurement oriented. So the screening is very easy. That we can refer or not refer frictional testing. That's absolutely true.
The Spanish, the English Spanish kit is $89.50 for the one for early childhood educators, and the English one is $84.25 for each of the kits. Okay.
So very similar to what was on my slide, folks, but it's not exact. So please go to the website for exact pricing. Very similar, not very different. But I did have a question. How would one go about implementing the screening if not in a Head Start type program? I guess that would really depend on what type of a setting you're in. Screening is something that tends to be most effective if it's done on a more global level. So, having all of the kids screened versus not having all of the kids screened, only doing one or two here and there. Not that you can't screen one or two kids here and there. That's absolutely okay too. But a lot of times when we're looking at preschools or we're looking at an early childhood center of some kind, having that screening in place for all of the kids is very effective because we're able to then really differentiate between who's having difficulties and who's not. But again, that question is going to be really dependent on where you're at. If you're in a private clinic and you have kids coming to see you, in many situations, if they're coming to see you, you may already be at a level of diagnostic or more detailed levels of assessment. So doing screening might not be necessary at that point. But again, it's going to depend on your setting. I did have a question. Does the rater have to be Spanish if they are administering the Spanish version? Nancy? You answered that. I'm answering that out loud because we did have a question come through that was good.
Sure.
Somebody did ask, does the rater have...
You need to be able to speak Spanish fluently if you're administering the Spanish edition, or what you can do is work with a bilingual professional. Best not to have a parent or a sibling or someone you've just pulled into the testing room to do the testing, mostly because on those language items you want to make sure that child's not cued and you get a reasonably accurate score. There's very few items on the test, so each one of them are rather important. But you would need to be able to, if you don't have a bilingual professional available to work with or to train to administer the test, then you would not be able to administer that test. It requires some fluency in Spanish.
Okay, thank you. Is there a timeline or benchmarking for when to conduct screening, aside from kindergarten readiness? So that's a really important question as well. In certain cases, you like to think about screening being implemented at sort of developmental levels, at different developmental levels. So if you have cases where children are exhibiting weaknesses, it's important that we screen those early. And because as I talked about earlier on in the presentation, intervening and increasing language development, increasing exposure to language and all those different things could potentially improve the child's development over time. That reciprocal nature we talked about earlier. So making sure that we do that earlier is good. But kindergarten readiness is a good time. Anytime a child is exposed to pre-K and pre-K programs as well. I know specifically Florida has a voluntary pre-K program that many kids that the state pays for, many kids are involved in. That's a good time as well. So there are different times depending on what your setting allows. The pediatric settings, early childhood. This is an early childhood educator's assessment. So really looking at situations where kids are in daycares or preschool settings. Those would be really helpful. Let's see here. I
guess I wouldn't do that because...
So we did have a question here. What would you do if a child won't have to answer any questions? when you retest with a parent there, they also don't answer any questions. Would you then just get examples from the parent that the child does at home or refer them? So I guess my question is, I'm trying to figure out what you mean there. So in certain situations, if a child were not answering, I guess is my question. I wonder if you can explain that a little bit more. So if a child was not answering specific questions, is that what you mean, or they didn't have to answer questions?
You know what, Adam, I'm wondering if she's asking because on the diagnostic preschool language scale, for certain ages you can give the child credit for examples that the child provides of those behaviors, but that's not the way the screening is set up. So if you're trying to administer the screening and the child doesn't respond and the parents really don't have any examples, I would go ahead and refer for testing, because that way during a diagnostic evaluation, the therapist has time to observe the child in some play with parents. The child might get more comfortable, and then the person doing the diagnostic testing can give the child credit for either examples that the parent provides or behaviors that they observe the child exhibit during testing. But the screening isn't set up that way to give credit for that. So, yeah, I would go ahead and make a referral.
Oh, good. Thank you, Nancy. Okay. I don't see another question coming through. We still have a couple minutes.
Someone asked if this will be posted online, and it will be. You can either look at speechandlanguage.com for the posting, or you can go to the web page on pearsоnclinical.com. If you go to PLS Screening for Early Childhood Educators, click on the Training tab, and there's the webinar that Adam presented last year. Most of the content is the same if you need to see it right away. If not, in a couple of weeks, this second webinar will be posted as well.
I did have a question that came through for testing areas such as the interpersonal section. Are you simply testing for just the presence or absence of the behaviors? Specifically, how do you score a child who demonstrates behaviors seldom, sometimes, or frequently? And that's a good question. So let me pull up that slide. Let me get there. Well, I apologize. Let me find it. It'll take me 2 seconds. There it is. Okay, so if we look at this, oh no, that's connected speech. What's going on? I had the wrong section. There it is. Okay, social interpersonal section. So if we think about it here, we are looking for typical versus atypical. So the demonstration of the following behaviors, it's the demonstration of these behaviors that is frequent, is the way that they interact. So, for example, if a child does not respond to his or her name when called, well, I have to think about this because my son is now 5. But if I were to go back and think about my son when he was 2, and he didn't respond to his or her name when called, he oftentimes didn't, but he still responded when necessary. So it was a sort of a selective time. Often, if he was distracted or was doing something else, I'm trying to think of my specific situation, so I can give you an example. And in that case, no, I would not mark does not respond to his or her name when called, because my son was able to exhibit the social behavior of understanding when somebody called his name that he would turn. So in that situation, he absolutely could exhibit that. Did not shift that attention from one activity or object to another. That means being so focused on one thing that doesn't shift between two things. And that's a typical behavior sometimes, the shifting of attention. It occurs, it starts to develop a little bit later on, but the presence of the inability to shift is what we're looking for here. So it's really not being able to shift at all there. Frequent tantrums that disrupt family life. I already talked about that one, but that's really thinking about it, that these are tantrums that are so loud and so disruptive that the family has to change their plans, or the family can't go out to eat. The family can't go to church because their child cannot sit there in tantrums in the middle of Mass. So there are different examples, but seldom, in most situations where we're thinking about the presence of atypical behaviors, a lot of times a typical kid will exhibit a behavior here and there. That's not considered an indicator in most situations. So what you have to be very careful with is not over-diagnosing or over-rating these items. Let's see here. Anybody else? Okay. I think that's it. Nancy, did you have any other comments before we ended today?
Someone asked if that's indicative of a language delay when a child doesn't answer, but it really just depends. And you may have already gone over that already while I was wildly typing, Adam. So if so, I apologize. But no, none of the results of this screening indicate a language delay. If the child does not pass the screening, then they need to be referred for a more diagnostic evaluation because, as we were pointing out earlier, sometimes children cooperate, sometimes they don't, and a screening is meant to be a very quick look at a child's behaviors, and a lot of times you need more time for the child to warm up and be willing to respond or to be able to observe, a greater variety of behaviors before you're able to make any kind of judgment about the child's skills. So that's always the next step.
All right. Thanks, everyone. We will. I'm going to close down the session. Thanks again, everybody, and have a great rest of your day. Thanks again, Nancy, and we'll talk to you all later. Bye.